Hi, I'm Shauna, a licensed professional counselor with Lucid, and today I'm providing tips to help you better understand your insurance and mental health coverage. Understanding your health coverage and how it impacts your access to mental health care is important, but it may be confusing even for the most seasoned insurance expert. Health insurance changes every year, and you may not realize what mental health services or treatments may now be covered for you. Most of the time, mental health and substance use coverage are a part of your benefit package. How you get your health coverage will impact how you can access in-network mental health providers. The first step to understanding your options is researching which type of plan you have and what that plan covers. You may have access to a private health plan through your employer or to a government-backed plan like ACA, Medicare, or Medicaid. Some things to look for regarding mental health benefits are coverage of outpatient services like your typical therapy session or psychiatric appointment, access to crisis intervention or inpatient facility visits, treatment for substance use, and coverage for screenings and assessments that can aid in diagnosis and treatment planning. You may also want to inquire about coverage of prescription medications that treat mental health conditions, which may be through your pharmacy benefit. If you're interested in connecting with a behavioral health provider, depending on your plan, your first step towards mental health treatment may begin with primary care. Some plans have this requirement to see any specialist, including for mental health. Check if your policy requires a prior authorization or if it requires a referral from your primary care physician. Based on your health plan and the state you live in, you may only be covered for a set number of mental health care visits and medication refills. Be sure to keep that number in mind so that you can avoid going over and paying out of pocket. You'll also want to ensure that your diagnosis is listed under your plan's coverage, as treatment for some disorders may not be covered. You'll want to know your copay costs, which is a fixed amount you'll pay for a service, so you can know what to expect when you have a mental health visit or accept a prescription medication as part of your care. Copays for in-network therapy visits typically range from about $20 to $50, and medication copays will vary based on your plan. Like with standard medical coverage, keep in mind that you will have to pay out of pocket toward the full amount of your deductible each year before your plan insurance will start paying for covered services. Copays may or may not count towards your deductible. If you don't have health insurance, or if your plan doesn't cover your mental health needs, there are resources available. Community mental health centers, 24/7 warm lines, and other organizations may offer low-cost or even free services to those without insurance. And remember, if you are in a mental health crisis, don't hesitate to dial 988 to reach immediate help. Health coverage can feel daunting to understand, but armed with the right information, you can navigate the world of insurance and access the treatment you need. If you like this video and want to learn more about mental health and self-care, follow us on YouTube and social media. Thanks, and take care.